The fifth learning outcome for gastrointestinal and hepatobiliary histology module is, describe how normal and abnormal gastrointestinal and hepatobiliary tissue stained using H&E should appear when viewed with a microscope. Use examples relevant to your practice. Does the candidate know how normal and abnormal gastrointestinal and hepatobiliary tissue stained with H&E look like microscopically? Can they identify abnormalities microscopically? Can they identify gastrointestinal and hepatobiliary tissue on stained slides? Do they know the characteristic features of gastrointestinal and hepatobiliary tissue that can be used to identify it? Overall, candidate consider layers like mucosa, submucosa, muscularis externa, serosa, adventitia, cellular changes, architectural changes, cell organization, and special features for each GI organ. Esophagus and non-keratinized stratified squamous epithelium with reedy ridges, GOJ junction, submucosal glands, muscularis externa transition from skeletal muscle to smooth to facilitate peristalsis. Large intestine and simple columnar epithelium, lack of microvilli, crypts of Lieberkühn, cell type goblet cells for mucus, protection and lubrication, colonocytes for water and electrolyte absorption via inconspicuous brush border, enteroendocrine cells for hormone release to regulate gut motility, small intestine and simple columnar epithelium with microvilli, villi and crypts of Lieberkühn, Brunner's glands, Peyer's patches, types like Paneth cells that secrete antimicrobial peptides, enterocytes for absorption of nutrients via their brush border, scattered goblet cells for mucus production to lubricate food passage and protection, scattered enteroendocrine cells as chemosensors to regulate digestion. Stomach and simple columnar epithelium, gastric pits, specialized glands, 3-layer of muscularis externa to facilitate churning, cell types like basophilic chief cells for pepsinogen, eosinophilic parietal cells for hydrochloric acid, mucus neck cells for protective mucus, enteroendocrine cells for gastrin secretion. For hepatic lobules, canaliculi, fenestrated sinusoids, space of D's, portal triads consisting of hepatic artery, portal vein and bile duct, central veins, cell types like hepatocytes, Kupffer and stellate cells, appendix and simple columnar epithelium, lymphoid tissue in lamina propria and submucosa, cell type abundant goblet cells for mucus or microfold cells around lymphoid follicles. Gallbladder and simple columnar epithelium, lack of muscularis mucosa and submucosa, prominent folds in mucosa, Rokitansky-Askoff sinuses, cell types like cholangiocytes for bile concentration, goblet cells for mucus or tuft cells as chemosensors. This is very specific to each organ and pathology. Therefore, candidates should consider abnormalities and how they affect the histological features seen microscopically.